Now let's focus on your surgery. To relieve back and leg pain caused by problems with your vertebrae, we would do what's called a spinal fusion. Like the name suggests, we weld or fuse vertebrae together, causing them to heal into a single solid bone. To do that, we remove a portion of an intervertebral disc that's pressing against the spinal cord or spinal nerve. The idea is, if pain caused by moving vertebrae doesn't move, your back and legs shouldn't hurt either. Your type of surgery is called a transforaminal lumbar interbody fusion, or TLIF. With a TLIF, an incision is made in the middle of your low back. To relieve pressure on a compressed nerve, an entire facet joint and most of the disc is removed. This also helps return the spinal nerve to its normal position. The top layer of the transverse process is removed as well. The transverse process is a small, bony projection on the right and left side of each vertebrae. A bone graft is inserted through the opening we made when we removed the facet joint. This graft will eventually grow into place. If the bone graft is from the patient's bone, a second incision is made from the back of the pelvis. Bone is then taken from the hip. Sometimes spacers are packed in as well. All of this is done to encourage fusion in between the two vertebrae. Holes are drilled into the vertebrae, and screws are put into the holes. Rods are then positioned between the screws and fastened into place. This helps provide stability for your spine and to prevent the bone graft from moving. A bone graft is also placed on the site where the top layer of the transverse process was removed. After that, the incision is closed and dressed.